Hi everyone! I am a second-year midwifery graduating student of Southway College of Technology, and for today's video, I will be doing steam inhalation procedure. What is steam inhalation? Steam inhalation is one of the most widely used home remedies to soothe and open the nasal passages and get relief from the symptoms of a cold or sinus infection, also called steam therapy. It involves the inhalation of water vapor. Equipments are a large tray containing a face towel or a patient's face towel, an extra blanket or a large bath towel, a basin or a large bowl, a kettle with a boiling water, and again this is optional, and a sputum container for sputum collection. Introduce yourself upon entering the patient's room. Prepare necessary equipments beside the patient's bedside table. Ask the patient to state their name and date of birth and compare their answer to the patient's armband or to the patient's chart. Primarily, healthcare providers needs to assist or check first the doctor's order for any specific instructions. Second, the general condition and diagnosis of the patient. Third, self-care ability of the patient to follow instructions. Fourth, the type, duration, and medication of inhalation. Fifth is the availability of equipments in the unit. In preparation of patient and environment. Explain the procedure to the patient to win her confidence and cooperation. Make patient to understand that he has to remain in bed. Close windows, doors, and turn off the fan to prevent from drought or dryness. Allow patient to empty bladder so that he will not be disturbed throughout the procedure, and to ensure the patient will remain in bed for several hours. Give bedpan or urinal for the bedridden patient. Provide Fowler's position with backrest, cardiac table, and extra pillows. If movements are restricted, place patient in a side-lying position or a position which is comfortable to her. Before we start with the procedure, we need to do hand hygiene. This is to prevent and to stop the spread of infection. Carefully pour the hot water from the kettle to the large bowl. With the use of a large blanket or a large towel, drape over the back of the patient's head. Instruct the patient to close eyes and slowly lower the head towards the hot water until you're about 8 to 12 inches away from the bowl. Be extremely careful to avoid making direct contact with the water. Tell the patient to inhale slowly and deeply through nose for at least 2 to 5 minutes. Don't steam longer than 10 to 15 minutes for each session. However, we can repeat the steam inhalation 2 to 3 times per day if still having a symptom. Use face towel to wipe off perspiration from the patient's face. Ask the patient, is the procedure helpful to her condition? Encourage the patient to bring out sputum. This is to get sterile specimen sampled directly from the patient for laboratory examination. Again, collect if necessary as long as it is ordered by the doctor. Do hand hygiene after the procedure. Place the patient in a comfortable position. Remove the equipments away from the patient's table. Appreciate the patient for cooperating during the procedure. Document any subjective response of the patient. This also includes the time of the procedures. This should be noted in the patient's chart and should be discussed with the care team. That is all for today's video. Thank you for watching. Bye-bye.